If you've just had a baby and you are, frantically doing crunches or sit-ups or some kind of high-impact cardio to lose the baby weight, you really need to stop.
Yeah, absolutely stop.
Because you might actually be actively pushing your internal organs downward and permanently damaging your pelvic floor.
It's really one of the biggest blind spots we have in women's health today.
Right. I mean, we're constantly surrounded by this immense cultural pressure to just bounce back after pregnancy. The magazines, the social media feeds, they all focus obsessively on the scale,
So
but they rarely, if ever, talk about what that weight or honestly the wrong methods of trying to lose it is actually doing to your internal anatomy. Like, are
yeah,
we focusing on the scale when we should be focusing on the structure?
exactly. We tend to treat postpartum recovery like it's just a cosmetic issue,
Yeah.
when in reality, it is a really complex structural and functional rehabilitation.
Yeah, which is why for today's deep dive, we are answering a very specific but I think incredibly vital question. Can postpartum weight changes affect laxity symptoms?
And to get to the bottom of this, we're looking at some fantastic sources. We have comprehensive clinical guidelines from NUSI in the UK, real-time 4D ultrasound studies from the Frontiers Medical Journal, and some really extensive physiotherapy data.
Right, because the goal isn't just to tell you what happens, but to really explain the underlying mechanics of why it happens, so you can actually understand the signals your own body is sending you.
Exactly.
And to understand those signals, I think we really need to define what is going on down there after childbirth, because the terminology gets thrown around a lot.
Oh, constantly.
And it can be terrifying if you don't know the mechanics. We hear terms like vaginal laxity and pelvic organ prolapse used almost interchangeably, but they really represent two different structural challenges, right?
Yeah, they frequently overlap, but you're right, they are clinically very distinct.
Huh.
So let's start with vaginal laxity.
Okay.
At a cellular level, laxity is a structural change in the connective tissue. The vaginal walls and the supporting tissues have been stretched, far beyond their normal capacity.
Right, to accommodate the baby.
Exactly. So the collagen fibers, which are essentially the microscopic ropes that give your tissue its elasticity and firmness, they have expanded and, in many cases, actually micro-teared.
Ouch. And for you, the listener, this basically translates to a physical feeling of looseness, right?
Yeah, there's a real reduction in natural tightness, which often results in reduced physical sensation during intimacy or even air trapping during normal daily movement.
Which is distressing enough just on its own. But then you have prolapse, which is where the internal architecture actually starts to fail.
Right.
I read this analogy from the MedStar Clinic source that made so much sense. It's like, if you think about the vagina like a sock, with pelvic organ prolapse, it's as if that sock is starting to turn inside out.
That is a perfect way to visualize it.
The tissues that are supposed to hold your bladder, your uterus, or your rectum in place have stretched so much that those organs just begin to drop. The toe of the sock, representing something like the cervix, starts falling downward.
And that structural failure causes a very specific set of sensations. You know that heavy, dragging feeling you might get at like 4 in the afternoon after carrying a baby around all day?
Oh yeah, that aching pressure right at the base of your pelvis.
That is the physical manifestation of prolapse.
Mm.
Your internal organs are literally pressing against the vaginal wall.
Wow.
And to understand why that happens, you have to picture the pelvic floor itself. Think of it as a muscular hammock sitting at the very base of your pelvis, made up of muscles, fascia, and thick connective tissue.
And during a vaginal delivery, that hammock has to stretch to just an extraordinary degree.
It really does.
The physical toll is staggering. When you look at the Toronto Physiotherapy data tracking first-time mothers, a full 58% report some form of sexual dysfunction, including severe laxity, an entire year after childbirth.
An entire year, over half of women.
Yeah, over half. But my immediate thought here, and probably the thought of anyone listening who's experiencing this, is about permanence.
Right, the fear that it's forever.
Exactly. Wait, isn't this looseness just an inevitable permanent reality of childbirth? Like, if a rubber band is stretched too far for too long, it never really snaps back. Does
Yeah.
the tissue just lose its elasticity forever?
That is the fear that keeps so many women suffering in silence. But the physiological reality is it's more nuanced. It isn't inherently permanent, but it also doesn't magically fix itself just because time has passed.
So what's actually happening in the body then?
Well, during pregnancy, your body is flooded with hormones, specifically one literally called relaxin. And its entire job is to soften your ligaments and connective tissues so your pelvis can, accommodate a growing human.
Makes sense.
But that hormonal laxity stays in your system for, quite a while postpartum, particularly if you're breastfeeding, because your estrogen levels remain very, very low.
And estrogen is what keeps the vaginal tissue thick and resilient, right? So when estrogen drops, the tissue physically thins out, making that hammock even more vulnerable.
Exactly. And then you add the physical trauma of the delivery itself. You have muscle stretching, potential tearing, nerve compression. Now, the body is an incredible healing machine, obviously.
Right,
A lot of this tissue will attempt to repair itself in the first 6 to 12 months.
right.
But collagen synthesis, the process of building new tight fibers, requires optimal conditions.
Okay, what kind of conditions?
It needs good blood flow, balanced hormones, and minimal mechanical stress. If those aren't met, the structural stretching remains. And this is where external factors, most notably your body weight, become the absolute deciding factor in whether that hammock heals or whether it continues to permanently stretch.
Wow, okay. Which brings us to the core of the issue, right? The weight of the matter. We know this pelvic hammock is compromised, it's trying to rebuild. How does a mother's body weight physically interact with this structure?
Well, the NICE guidelines and the Women's Health Clinic sources state very clearly that a body mass index over 25 is a major modifiable risk factor.
Right.
And obesity, a BMI over 30, dramatically spikes the risk of both prolapse and daily incontinence.
And why is that exactly? Is it just the pure weight?
It's basically a pressure problem. It comes down to the physics of intra-abdominal pressure, or IAP. Your pelvic floor has one primary mechanical job during the day, which is to counterbalance the pressure coming from above.
Okay, so when you carry excess weight, specifically abdominal weight, it acts as a constant, unrelenting downward force on those vulnerable tissues.
Yes, exactly.
It makes perfect sense if you think about your core like a pressurized balloon or a canister. You've got your diaphragm at the top acting as the lid, your abdominal muscles wrapping around the sides, and the pelvic floor at the very bottom.
That's a great analogy.
So if the pelvic floor is the weakened bottom of the balloon and you add a heavy physical weight to the top, all that internal pressure has nowhere to go but down, right through the weakest point.
You absolutely nailed it. It's not just mechanical strain, though. When that canister bulges out at the bottom, we see it physically manifest in ways that create a whole cascade of biological problems.
Oh, like what?
For instance, the constant weight bearing down on the pelvis can lead to what clinicians call nerve conduction abnormalities.
Which means what exactly for the listener? Essentially, the neurological wiring gets pinched or damaged.
Exactly. Your brain is trying to send a signal to your pelvic floor muscles to engage and tighten because, say, you were about to sneeze.
Right?
But because the nerve is compressed by excess weight, the signal gets delayed. The muscle doesn't contract in time, and you leak.
Ugh, that is so frustrating.
And furthermore, obesity restricts localized blood flow. We just talked about how the body needs optimal blood flow to synthesize new collagen. If the heavy load is compressing the capillaries in the pelvic region, the tissue is starved of the oxygen and nutrients it needs to heal.
That makes total sense.
On top of that, visceral fat, which is the deep fat stored around your internal organs, is highly metabolically active. It isn't just sitting there. It constantly releases inflammatory chemicals into your bloodstream.
Oh, wow. So it's actively working against you.
Yes. So you have a stretched hammock under constant physical pressure with pinched nerves, restricted blood flow, and chronic cellular inflammation. It is a biological perfect storm that prevents the laxity from resolving.
And we really have to talk about the cruel biological trap of how that visceral fat gets there in the first place, especially for a new mother, because it's not just about what you're eating, right?
Not at all.
When you're a new mom, you are chronically sleep deprived. You are operating in survival mode, you're highly stressed and exhausted.
Right.
And that emotional and physical stress causes your body to pump out massive amounts of cortisol. Cortisol is an emergency hormone, and it biologically forces your body to store fat directly around your midsection, right over the organs.
It is an involuntary survival mechanism. The body perceives the stress of a newborn as a literal threat, so it packs on visceral fat to keep your organs safe and energized.
Which is just so unfair.
It is, because the unintended consequence is that it adds even more deep physical pressure right on top of your vulnerable pelvic floor.
So hearing all this, my first instinct as a mom would be to hit the gym immediately.
Of course.
Like if excess abdominal weight is putting all this terrible pressure on my pelvic floor, causing the dragging and the leaks, then I need to get rid of it fast. I'd want to start doing, high intensity interval training, heavy lifting, or endless crunches to drop the weight.
And that instinct, while completely understandable, is exactly what drives women into a cycle of permanent pelvic damage. This is the tragic flaw of the bounce-back culture.
Right.
The methods women are sold to lose the baby weight quickly are often the exact movements that destroy their pelvic health.
There is a fascinating study from the Frontiers Medical Journal that looked into this. They tracked 90 postpartum women to see exactly what happens during these common workouts. And they didn't just ask them how they felt, they hooked them up to four-dimensional pelvic floor ultrasounds.
Taking the guesswork completely out of the equation, we can actually see the physics of that pressurized canister in action.
Yeah. So they had these women do what essentially amounts to a crunch, lifting their heads and shoulders off the table, and exercises where they forcefully drew their stomachs in.
Right.
And the ultrasound showed that these standard core maneuvers caused immediate pelvic organ descent and something called hiatal area enlargement.
Which sounds incredibly technical, but to visualize hiatal area enlargement, just imagine the opening in the muscles of your pelvic floor. When these women did a crunch, the immense downward pressure literally forced that muscular opening to stretch wider.
Oh my gosh. And pelvic organ descent means the ultrasound caught the bladder and uterus being actively pushed further down into the vaginal canal.
Exactly.
So, wait. If a listener is frantically doing crunches and high-impact cardio to lose the baby weight, they might actually be actively pushing their organs down and making their vaginal laxity worse.
They absolutely are. If you are doing a crunch with a weakened pelvic floor, you are basically squeezing the middle of that pressurized canister as hard as you can.
And the bottom's just going to blow out.
Yes,
Yeah.
you are weaponizing your own intra-abdominal pressure against your healing tissue.
That is wild.
And traditional high-impact weight loss exercises, box jumps, burpees, aggressive core routines, they create massive, sudden spikes in pressure inside the abdomen.
And when you consider the postpartum belly bulge, it becomes even more precarious, right? Because the Bloom method source points out that this bulge is rarely just fat.
Exactly. It is often a mix of fluid retention, connective tissue laxity, and diastasis recti, which is the physical separation of the abdominal muscle down the center of your stomach.
So the walls of the canister are literally split open.
Yes. And when you have that abdominal separation, your core muscles cannot properly coordinate with your diaphragm and your pelvic floor. If those three components aren't moving in perfect sync, the internal pressure violently seeks the path of least resistance.
Right.
Losing the weight is inherently good for reducing resting pressure, but doing it through high-pressure, uncoordinated movement just destroys the hammock. You might lose 5 pounds on the scale, but you could easily gain a stage 2 prolapse in the process.
Which leaves the listener in an incredibly frustrating bind. You have this excess weight generating chronic inflammation and pushing down, causing daily laxity symptoms, but you can't just jump into a boot camp class to fix it without actively pushing your organs further down.
Exactly, it's a huge dilemma.
So we need a blueprint for safe solutions, and the clinical guidelines present a really interesting perspective on the whole weight versus action dilemma.
They do. The NICE guidelines offer a crucial rule here. They explicitly instruct healthcare providers do not wait for a woman to lose weight before starting other pelvic floor treatments.
Which is a relief, because healthy, sustainable weight loss takes a long time. The NHS advice is about half a kilo to a kilo a week. Women shouldn't be told to just go lose weight and come back in 6 months while they're suffering.
No, absolutely not. The treatments have to run concurrently. You have to rehabilitate the tissue while slowly reducing the load. But what is truly remarkable in the data is how incredibly impactful even a tiny amount of weight loss can be on the symptoms themselves.
Yeah, the numbers on this are wild. Research shows that a minor weight reduction of just 3 to 5% of your total body weight can decrease episodes of urinary incontinence by 50%.
Half of your daily leaks can vanish from just a 3% reduction.
But from a mechanical standpoint, how does that even work? How can losing just a few pounds yield such a massive result?
It goes back to the visceral fat acting as a multiplier. When you lose that first 3 to 5% of body weight, you are disproportionately losing visceral fat from around your organs.
Oh, I see.
That immediately lowers the inflammatory markers circulating in your pelvic region, taking the tissue out of a state of constant distress.
Right.
It also drastically reduces the resting pressure inside the abdominal cavity. You're taking the core out of the red zone. The nerves aren't as compressed. The capillaries open up, and the whole system suddenly has the breathing room to function.
But, and I want to push back on this a bit, the anatomy itself hasn't necessarily changed, right?
Right.
Like, studies explicitly show that weight loss won't magically snap a prolapsed organ back into its original position. Anatomical regression is statistically insignificant just from losing weight alone.
That's true.
So, if weight loss doesn't actually cure or reverse the physical anatomy of a severe prolapse, why do the guidelines push weight management so hard for these women?
This touches on a really profound philosophy in clinical care. The ultimate goal of medical intervention isn't always picture-perfect anatomy. It's restoring the patient's quality of life.
Okay, that makes sense.
The prolapse might still technically be there on an ultrasound, but removing that excess downward pressure brings massive symptom relief. It stops the chronic nerve pain. It stops the daily leaking when you laugh. It relieves that awful, heavy dragging sensation.
It transitions a woman from being constantly anxiously aware of her pelvic floor to just being able to live her life.
Exactly, reclaiming her physical confidence. But while safe weight loss relieves the pressure from above, we still have to rebuild the structural support from below. It's an integrated two-front approach.
And rebuilding from below does not mean doing hundreds of frantic Kegels while you're stopped at a traffic light.
No, please don't do that.
Because if your pelvic floor is tight, fatigued, and holding on to trauma from carrying excess weight, doing endless Kegels will actually make the laxity and pain much worse.
Because a tight muscle is a weak muscle. If your bicep is permanently clenched, you can't lift anything with it. You have to learn to relax the pelvic floor before you can strengthen it.
Right, which is where specialized pelvic floor muscle training, or PFMT, becomes essential. And it starts with diaphragmatic breathing.
Yes. You have to learn how to breathe deeply into your ribs and your belly, allowing the diaphragm to drop. When the diaphragm drops, the pelvic floor naturally relaxes and lengthens.
And then when you exhale, the diaphragm rises and the pelvic floor gently lifts.
Exactly. You are retraining the entire core canister to manage pressure synergistically.
And the clinical data proves this works. Toronto Physiotherapy notes that this targeted PFMT reduces the risk of symptomatic looseness by 45%, even in mothers who suffered muscle trauma during birth.
It's incredibly effective for rebuilding coordination. But we also have to acknowledge that for some women, physical therapy and weight management just aren't quite enough to resolve severe tissue laxity.
Right, sometimes the stretching is just too profound.
Yeah. And in those cases, there are non-surgical medical interventions that are highly effective.
Like deserial injections, for instance, which isn't just cosmetic, it's cellular rehabilitation. It uses a specific type of hyaluronic acid formulated for intimate tissue.
Right, because hyaluronic acid naturally draws in and holds massive amounts of water. When injected into the vaginal walls, it physically rehydrates the thinned, stretched tissue at a cellular level.
Restoring the plumpness and tension that was lost.
Another fascinating avenue is platelet-rich plasma, or PRP therapy. They take a small sample of your own blood, isolate the growth factors, and inject them directly into the lax tissue.
Basically tricking the body into localized healing, commanding it to build new blood vessels and ramp up collagen.
Exactly. And for women whose laxity is driven by those postpartum estrogen drops, localized hormone replacement therapy can directly replace the hormones needed to maintain tissue elasticity.
It's incredible how far the science has come. But all of these treatments, the hyaluronic acid, the PRP, the estrogen, they only work long-term if the underlying mechanical pressure issue is resolved first.
That is the key takeaway.
Like, if you inject hyaluronic acid but continue to carry excess visceral fat and do high-impact crunches, you are just going to crush the newly repaired tissue all over again.
It all has to work in harmony. The pressure management dictates the success of the tissue repair.
Absolutely. So let's pull all this together. We started this deep dive trying to understand if postpartum weight changes affect laxity symptoms. And the answer is an undeniable yes.
Yes, absolutely.
Postpartum weight absolutely dictates laxity, but not just because of the fat itself. It matters because of the immense internal pressure it generates inside your core canister.
Right, pushing down on a pelvic hammock that is already stretched, restricted of blood flow, and hormonally vulnerable.
And the path to true healing isn't a frantic rush to drop pounds using crunches that actively push your organs downward. Healing is a coordinated effort to manage pressure,
Gently reducing the load while rebuilding the core canister through breath-led movement.
allowing the body the time it needs to synthesize new collagen. It's about working with your body's mechanics, not fighting against them.
And, I want to leave you with a final provocative thought that reframes this entire process.
Okay, let's hear it.
We have spent this deep dive talking about the physical weight of the body, the pounds on the scale, the visceral fat, the physical load pressing down. But I really want you to consider the physiological impact of psychological weight.
Oh, wow. What do you mean?
Well, stress, anxiety, and the immense mental load of new motherhood literally change how we breathe. When we are stressed, we abandon that deep diaphragmatic breathing. We take shallow chest breathing gasps.
We unconsciously suck our stomachs in and clench our jaws.
Exactly. And that chronic physical tension locks up the diaphragm, completely paralyzing the top of our core canister, which drastically increases the downward pressure inside our pelvic cavity.
That is, wow.
So what if true postpartum healing isn't just about managing the physical weight on the scale, but managing the invisible emotional weight that is literally altering the atmospheric pressure inside our bodies?
That completely changes the paradigm. Are you holding your breath right now just listening to this? Let it go. Take a deep breath into your ribs and relax that canister. Thank you so much for joining us on this deep dive. Keep asking great questions about your health. Keep challenging those overly simple narratives on social media. And remember, your body is not a broken machine. It is a brilliant, dynamic structure. And with the right blueprint, it can absolutely be rebuilt. Take care of yourselves.